The Gauteng Health Department says it will open more COVID-19 vaccination sites. The provincial department has already vaccinated 16,800 healthcare workers at the Steve Biko and Chriselda Baragwanath hospitals. Charlotte Maxeke and George Mukhari hospitals will now be added to the list of vaccination sites. And at the weekend, you know that we received another 80,000 doses of the Johnson & Johnson vaccine. Gauteng's vaccine rollout program is under scrutiny after hiccups and delays that saw healthcare workers from the Steve Biko Hospital queuing for up to 7 hours to get the jab. Let's get more information on this and bring in my colleague Chriselda Lewis, who's coming to us live from the Charlotte Maxeke Hospital. Chriselda, always a pleasure having you on. Look, we just passed this grim milestone of 50,000 fatalities due to COVID-19 related illness. But I guess a measure of solace is that we have this vaccine that is being rolled out. Give us the temperature views on the ground where you are.
And those figures, Blaine, are exactly why it's important that the number of vaccination sites does increase. The latest, Charlotte Maxeke Hospital, where I'm crossing live to you from, you would recall that at this particular hospital, there are 9,000 doses of the vaccine that have been given for this week at the facility. And you'd recall, Blaine, during the height of the COVID-19 outbreak, SABC News had been crossing live from here where, healthcare workers were quite concerned while they had to give care to ordinary South Africans. They themselves were at the front line of fighting the COVID-19 virus. 900 of them had been infected here at the Charlotte Maxeke Hospital. So I think this particular moment for them quite momentous in the sense that it's their turn now. It's their turn to have access or to be vaccinated against COVID-19. And you get a general sense of relief that we certainly didn't get as we'd been working quite a number of times here at the Charlotte Maxeke Hospital. And quite a number of them will be vaccinated today. Charlotte Maxeke Hospital has been added to that site of vaccination sites. Let me speak to one of the doctors who is first on that list, Dr. Zamperini. He joins me now. Dr. Zamperini, thanks a lot for your time this morning. I see you and quite a number of your colleagues all lining up already. This must be quite an important moment for you and them.
I think it's a very important moment. It's a very emotional moment as well. We saw the second patient in South Africa, the first patient in Gauteng at our hospital on the 7th of March. So 5 days short of a year later, the vaccine is rolling out here, and it's really exciting. It's like I said, it's a bit of an emotional day, but 240 including 240 colleagues, including myself, will be vaccinated today, followed by about 800 to 1,000 a day for the next 2 weeks. So it's going to be a huge rollout. The team here, my head of department, Dr. Sarah Stacey, my colleague, Dr. Lyle Murray, they've, as well as Dr. Tendom Papele, Mr. William Malabati, the whole team here, including our CEO, Ms. Gladys Bagoshi, has put in a lot of time, a lot of after-hours work, just a lot of blood, sweat and tears into this program, as well as the WITS RHI team, the study team who's involved here. So it's an exciting day, it's an emotional day. We're just looking forward to getting started.
Yeah. Doc, paint a picture for us of, at the height of COVID-19, what it was like for you as frontline healthcare workers, having to ensure that you are safe while you take care of the general public who's come to ask for assistance. It must have been quite a mammoth task.
It was a huge task, and it wasn't just, I'm from the internal medicine department, we managed patients in the hospital, but it was everyone from the emergency department who, had tons of patients coming in with symptoms ranging from, a bit of a sniffle all the way to needing intubation and ICU. And it started out there through the hospital, and it's not just been the doctors, it's the nurses, the porters, the cleaning staff, it's everyone in this hospital, radiographers, physios, occupational therapists. We were learning on the fly like the rest of the world. So it was an issue of, do we have enough personal protective equipment, PPE? Do we have enough medication? Do we have enough beds? And through good management, through the Department of Health, through the management here at the hospital, we've really done well. And we upscaled from 1 bed all the way through to 17 wards, 6 of which were COVID positive wards. And it's also our junior staff, our junior doctors, interns, medical officers, registrars, who really were truly on the front line. So it's been a wild ride.
Dr. Zamperini, I'm going to ask to do something in just a moment. I'm going to ask my colleague Tulo Monaro to perhaps come with me. You'll walk with me just a little bit here. Just show us a little bit of how the setup is. We'll try that right towards the beginning of the hall here, not to disturb the proceedings that are taking place. Please walk with me. I'm going to ask my colleague Tulo Monaro to come with us. There'll be a bit of a shake on the camera there in a second, or unfortunately it doesn't look like we'll be able to do that. Or just come with me this way. I'm really hoping so this will be the first site where somebody comes. This will be where they will register.
Yeah, so basically we have 5 rows, enough to vaccinate 40 people at a time. You'll come in here, people will be seated here in the waiting area. Come here, be registered, check that you have a voucher that's been issued by the electronic vaccine database system. Check your ID, check that everything matches up. From here, you go into the hall where you're allocated a seat. I'm not sure if you can see in a bit of a contrast, but you'll have a seat over there. We have tablets at each vaccine station where your details will be checked again. Once your details are checked again, it's a matter of the trial staff, mixing up the vaccine, or drawing up the vaccine at least, bringing the vaccine through, wipe of the arm, jab of the needle, and then you're all done and hopefully feel better.
Okay, great. All the best, Dr. Zamperini. Thank you very much indeed. I'm going to ask you to please move towards that direction. I'm not sure if our colleague Tulo Monaro is able to capture. This is the entrance here where the vaccination itself will be taking place. And right here is where all those, the first nurses, so the frontline workers, will be vaccinated. I'm not sure if you'll be able to get quite a good glimpse of that at the moment. The program has already started at this stage. You'd see that quite a number of the staff who will be assisting in this process have already started arriving. So quite a momentous occasion in this particular instance, Blaine, in the sense that this was one of the first referral hospitals for COVID-19 patients. So you would have those healthcare workers in the forefront of the fight against COVID-19. 900 of them contracting the virus, and now you have a little over 9,000 doses at the Charlotte Maxeke Hospital. I understand from the CEO of the Charlotte Maxeke Hospital, Gladys Bokhoshi, that in the next weeks you're going to have 9,000 more that will come through. So it's quite a fast-paced process in trying to ensure that the healthcare workers, those at the forefront of this fight, are vaccinated and feel somewhat safe.
Yeah. Important reporting indeed, Chriselda. Thank you very much indeed. It's worth noting that although these vaccines are being rolled out, it's so important to keep to the rules and regulations that we've been used to in terms of using a mask, washing your hands, social distancing until we get that herd immunity. And, you know, it's important to know that viruses will not mutate if they don't replicate. So important reporting indeed. Chriselda Lewis, we'll let you go. Thank you very much indeed for your reporting. All right.